Hi, I'm Dr. Chris Heimlich, DC. What is fibromyalgia? Fibromyalgias have several things in common, including widespread achy muscles, fatigue, pain, insomnia, fibrofog. But even with all these similarities, it's not the same for every individual that's given this diagnosis, or label, if you will. Now, I've worked with hundreds of women with fibromyalgia, and the one thing that they all had in common was they were all different. Now, don't get me wrong. These symptoms are real. Those that get diagnosed with fibromyalgia, suffering the way that most people can't even comprehend. Their fight seems never ending. Quite frankly, most of the family members of these sufferers with fibromyalgia, they can't even comprehend what's wrong with them. They've got their loved one right there. They look normal. And they've probably been to every type of doctor there is out there. But they're still suffering. They still have the pain. They wonder, how come my loved one hurts all over? They can't sleep. They're often unable to get the words out or perform a simple task, a mental task, because their brain seems cloudy or foggy. Being misunderstood, that's pretty much an everyday reality for a fibromyalgia sufferer. But what's wrong? Why do they have these symptoms? Well, the unfortunate truth is many doctors give fibromyalgia diagnosis when they feel like they've done all that they can do, done all the investigation, and they just don't want to go any farther with the patient, period. Now, we know that fibromyalgia is a neurological problem. Volumes of research shows that, time and time again. Now, most doctors nowadays will admit that. However, they don't do anything for the patient neurologically. Giving someone an anti-seizure medication, using it for off-label, to me doesn't consider as far as treating them neurologically. And since it is a neurological problem, it has a huge component of neurological, brain-based therapy is a huge part of our treatment protocol. And when we apply principles of functional neurology and brain plasticity, we can make amazing changes in the symptoms and the brain function. The astute doctor is going to look farther than that, too. Many things can contribute to neurological problem: immune dysfunction, gastrointestinal dysfunction, hormonal imbalance, intestinal dysbiosis, candida, among a ton of other things. Success with fibromyalgia treatment depends on stepping back, taking a look at that whole big picture again, taking all those pieces and putting them together in the puzzle. So at all fibromyalgia label, some doctors give the patient simply means there's nothing else they can do. To me, it means that there's definitely something wrong, and we need to work hard to figure out what the root of that problem is. Now, of course, it helps out, when you're looking for the right things. Now, I see changes in patients with fibromyalgia that are nothing short of amazing. Me and my incredible staff, we still get chicken skin when our patients come in and tell us how their life has changed with our help. They're no longer suicidal. They don't have these things. They're no longer depressed. It's amazing. Our success, our ability to take someone in chronic pain who's lost all hope and guide them back to health, that's why I get out of bed in the morning. This makes all the years of continuing education, and it makes it worth it. Having a fibromyalgia patient tell you how much I've changed their life, there's nothing quite like it in the world. And I hope you're the next person to tell me that. I'm Dr. Chris Heimlich, DC. Thank you very much.